My name's Dr. Eve, I'm an obstetrician and gynaecologist, and I'm just going to say a few words about miscarriages. Miscarriages are far more common than people realise. In fact, 1 in 2 or 3 pregnancies end in miscarriage, and I think it's almost comforting for women who do have a miscarriage to realise that it is common, and that the vast majority of women that have miscarriages go on to have a full-term healthy pregnancy later on, often with no treatment needed. We test for pregnancy very early now, so an awful lot of early miscarriages were not detected in the past because we hadn't detected the pregnancy to know that in fact it was a pregnancy that ended in miscarriage.
Hello, my name is Peter Harris and I am a consultant gynaecologist. Even a simple question like how common miscarriages are is a difficult question to answer. Some of the textbooks used to say that 1 in 5 pregnancies would end up in a miscarriage, but nowadays they say that the risk of miscarriage is about 1 in 3 pregnancies. I don't think that the risk of miscarriage has changed over the years, it's just that people are better at detecting when people are pregnant. So if somebody has bleeding in early pregnancy, they're often referred and then seen by the Early Pregnancy Assessment Unit. In these units, people will be seen by a nurse or a doctor, and they may have various investigations such as blood tests or an ultrasound scan before.
Hi, my name is Vidisha Chatterjee and I'm a specialist doctor in obstetrics and gynecology at West Suffolk Hospital NHS Foundation Trust. And I think we would like to discuss miscarriage today because this is something that many women in the reproductive age group experience, and it can be very traumatic for them and their partners and their families as a whole. And the different aspects of how we diagnose it, how we can treat it, and how best we can support the patient and her partner. As medical professionals, we realize that this is a very traumatic thing for any experience for any woman to go through, and also for their family. So we try to be as sensitive as possible to the ladies' requirements. The nurses on the ward, they ensure there's privacy that's maintained if they have to be admitted, and they are very considerate towards their needs. If they have wish for any family member or their partner to be present during the procedure, we do encourage that. And once it's completed, we do give them an information leaflet about what we would normally be doing with the products of conception, and we ask for their views and what they would like done with regards to the fetus that has come out. There are also support organizations that we signpost these ladies to, like Petals and other websites and self-help groups who can help them, and later on when they go home they can give them a call, and these organizations are able to support women with needs. If we feel that if the woman requests, we often organize an appointment later with the gynecologist just to have a chat through what went on. And in some group of women, a small section where they are having recurrent miscarriages, we would request some additional investigations to assess the reason for it and to see whether anything can be done to prevent it.
For women having a miscarriage, for them, they feel very much like they have lost their baby. For them, they have lost their baby, and I think it's always worth bearing that in mind when you're dealing with women who are having miscarriages, because then it allows you to maintain that sense of empathy and condolences for them, because this is something that is not just a medical problem, it is a grief event, and they do get very, very emotional about it. So I think it's really quite important that everybody remembers that. Some ladies want to conceive straight away afterwards to try and put it behind them and move on. Others need to go through the grieving process before they're ready to conceive again. The ones that want to start straight away are always advised to wait until their menstrual cycle has normalised, because unless their hormones are cycling normally, there's a possibility that they will miscarry again because the hormones cycle can't move into the right synchronisation to maintain a pregnancy. So we always say, please make sure you're having normal periods and then try again.